This is a group of people who have worked tirelessly with CMS, with the Health and Human Services in Washington, D.C., CMS specifically that oversees Medicaid, Medicare, to come up with what is going to be truly a transformative and sustainable and fantastic program. This has been a good, open dialogue. It's been in good faith. I'm encouraged by that. This is the kind of thing that makes me confident that they will, in fact, support the waiver that we are requesting. This is an 1115 waiver. You're all familiar with that term. Some of you may or may not know exactly what that means, but in essence, any application of Medicaid dollars in any state come in the form of some type of waiver program. And there's many iterations of them, but we are asking for one that will really help to transform us and focuses on three distinct things. We want to create better health outcomes. Number two, we want to familiarize participants with the commercial insurance program and the way it works, because the intent of this is not to create a trap for people, it's not to create a dead end for people, it's to create opportunity, it's to come alongside and help people, because ultimately we want people to be on private health insurance because they're working, because they're involved in their communities, and they are engaged as employees of companies where this is available to them. So that we want better health outcomes. We want people to be familiarized with being engaged in their communities and ultimately being familiar with the commercial health insurance arena. And thirdly, and critically, as we've said, we want to make sure that this has long-term sustainability.
We will be imposing premiums on the people covered in the waiver. We heard loud and clear from the advocacy community that they preferred premiums versus co-pays. So for people both all the way from 34% of poverty up to 138% of poverty, there will be premiums. Now these premiums will be fixed dollar amounts ranging between $1 up to $15. If they pay their premiums, then they don't have to pay the co-pays.
We're going to be able to increase access to IMDs. These are Institutes for Mental Disease. It also allows us then to kind of work with our existing entities that are out there in the state to be able to offer best practices and standards of care and to coordinate the care. So importantly, this pilot project allows us to address the drug issue that we have, the drug addiction issue we have in the state that the governor talked about. It also allows us to take into consideration some of our chronic diseases and to incorporate that into now a pilot project that we are going to be looking at certain counties to be able to roll that out. As the governor mentioned, there are over 200 counties in the country that are looking at high risk that are associated with drug addiction. We have 54 of those in Kentucky, so we were going to be looking into those 54 counties and offering this pilot project there.
If in fact this comes into play, I am confident, I can say this, I do have a great degree of confidence that we will have a healthier population. We will have more people with access to health care. It will be more accessible to them. It'll be more affordable to them. The state will benefit from that. Our people will benefit from that. I'm excited by the possibility. I'm looking forward to the conversation.